For many clinicians, the pressure of treating a never-ending line of patients, always moving on to the next one and the next one, can make even the most dedicated healers wonder if they're up to the rigors of the job. There is a term for this. Second victim syndrome acknowledges the toll that giving care can take on care providers. For decades, the code of conduct was understood to be swallow hard and get back to work, soldier on. But the COVID pandemic has been a cultural game changer. Its lasting effect on the care teams that fought so valiantly to treat a tidal wave of very sick patients meant that we had to start talking about issues like burnout and addressing well-being. One result of the pandemic experience has been an increase in the number of hospitals and health systems that now employ chief wellness officers, a trend that is growing. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly with AHA Communications. In recent years, the idea that caregivers themselves need ways to deal with the stress and exhaustion of the job has taken root and spread throughout our healthcare system. In this podcast, one physician who began as an ER doc describes her journey to chief wellness officer with a major health system today. As she says, in 10 years, chief wellness officer will be as common as having a chief of anything else. Let's listen in.
Thanks, Tom. I'm Elisa Despacochaga, AHA Vice President of Clinical Affairs and Workforce. And today I'm really pleased to be joined by Dr. Suzanne Bentley, Chief Wellness Officer, Director of Simulation, Innovation, and Research, and attending physician at the New York City Health and Hospitals in Elmhurst. Today, we're talking about her journey in leading and participating in organizational-wide wellness programs and the great work that she's been able to do there. So, Dr. Bentley, to get us started, can you tell me a little bit about yourself and your role at New York City Health and Hospitals?
Sure. Thanks so much for having me today. I'm really honored and excited to be here with you, as you mentioned. So I'm Susie Bentley. I'm the Chief Wellness Officer at Elmhurst. Important perhaps to point out, I'm actually the first Chief Wellness Officer at a New York City Health and Hospitals site. So we have 11 acute care hospitals, and we have a wonderful system-wide Chief Wellness Officer. But I am the first and perhaps the pilot, which is going well. So hopefully there will now be more, but at a site. So it's really been an adventure because it's been a bit of an unprecedented role that has definitely evolved over the last year and a half. As you mentioned, I have several other hats at Elmhurst, and some could look at my career and it's kind of bobbed and weaved and evolved. But I think debriefing has really been kind of the grand unifier in all of the professional roles, both as an educator, in residency leadership, doing simulation, and then obviously now through wellness. And it's just been an absolutely wonderful and very, very worthwhile position to now be in.
That sounds awesome. Well, to get us started, you started in this wellness journey, and I know you've had a bunch of different things that you've brought to this. As you started to lay out the work to be done, particularly having a system level effort, and now you're bringing it to the local site, what helped you really think through and refine what your messaging was, how you asked your colleagues and others in leadership to support the work you were doing and really help you get launched in this work?
So I'd say that my journey with workforce wellness really started probably informally as a resident. I think as I was struggling, so I'm an emergency medicine physician, as was mentioned, as I was struggling with processing a lot of hard cases and learning really how to handle some of the emotional struggles as well as frustrations that can come with delivering healthcare, even probably some degree of burnout of my own. I really felt compelled to try to encourage people to talk about cases at a time culturally where nobody was really talking about things. You just kind of swallowed hard and went back to work. And I really was left even at certain times wondering if I was strong enough to do emergency medicine, because it just never totally sat right that you could take care of such critical cases in human lives and then just move on to the next, no matter the outcome. And I think that's where I got curious about how we could do it differently. Then Dr. Eric Way, one of my colleagues at Health and Hospitals, introduced Helping Healers Heal, which is a peer support program. And this was back in 2017. And I first learned through that about the concept of second victim syndrome, which was really interesting to me because that was now a formal clinical term acknowledging the toll that healthcare delivery takes on the caregivers, really with us being the second victims at times. And I just felt such a pull to serve, to get more involved, and saw that as how we might be able to change the culture of how we look at wellness. So a lot of the initial work I did was through running Helping Healers Heal at Elmhurst. And I'd say the messaging then was really just trying to get people to acknowledge that, things needed to be talked about, that wellness needed to be talked about for the actual humans doing the healthcare themselves. A lot around just, it's okay to not be okay. This is hard for everybody, kind of no matter how they're acting, and really working through a lot of the stigma that I think is present at all levels in healthcare, definitely with physicians. And then COVID happened. And as I'm sure you are aware, Elmhurst was just absolutely devastated, like so many institutions across the globe. But having such a marginalized population being hit first in New York City, it really just devastated everyone. And suddenly, it was almost weird and not okay if you walked around like you were fine. If your answer to how are you was, oh, I'm good, I'm okay, that was really a red flag, and denial only gets you so far. So I think the gray lining, because it wasn't quite silver, but for COVID, was this amazing ground leveling vulnerability that suddenly people wouldn't run away from me when I tried to introduce discussions around how we could support staff, how we could do it differently, because everyone was struggling and everyone suddenly almost became desperate, almost survival, really, for those delivering the care, to how we could get through it together. And I think that is how, really, right coming off of the pandemic, from doing so much programming both at Elmhurst as well as for health and hospitals with many of my colleagues, we were able to start talking about, should we have chief wellness officers? This is very clearly a gold standard role that is in a lot of places, but not everywhere. And I think in 10 years will be, as common as having a chief anything else. But that kind of set the stage, I think, for a lot of people to be very open to, what this role could be and how we could start to look from an organizational lens, kind of to how we could support staff, how we could show up differently for staff. So I think the messaging really went from one of, let's talk about how you feel, because we have to do that, or we're, not going to stay strong and be able to do this for forever, for our whole careers, really to one of, how are we going to stay strong together? How are we going to put things in place, so that we don't have to pick up the pieces quite as much. We can actually kind of get ahead of a lot of this. And then also into, much more robust discussions too around, how are we measuring this? How are we even staying on top of how our staff are doing, which I think is kind of an ongoing debate that we have in the wellness realm, around meaningful metrics and kind of, how to do informed programs. So it's really, really evolved in a very, very cool way, as well as perhaps overwhelming and all-encompassing way, because there's just so much work to be done.
That is awesome. I can only imagine, in having talked to many of your colleagues in New York City, the impact that COVID had to really push everyone to this point of understanding that not only am I not, don't think I'm okay, everybody's not okay. And we all need to talk about it if we're going to get to the other side. While I don't love the method that got you there, I'm glad it got you to that conversation. Let's talk a little bit about some of the work that I know you've done a lot on, in pulling this all together. Is you've really tied a lot of the well-being work to your roots, I would say, in quality and patient safety, and really done a lot to use that structure that you've built, and the entire field has built, to make sure that we are staying true to our mission and vision related to quality and patient safety, and using some of the measurement and metrics and structures to really help address well-being as well. So I'd love to hear about how you're doing that.
That is such a great and very powerful question, and one that, sometimes makes me chuckle, because I work so closely with so many of our amazing behavioral health colleagues, many of whom I, started Helping Healers Heal with. And I was routinely asked initially, oh, so are you a psychologist? Nope. Oh, so are you a psychiatrist? No. So what are you? And I would say, oh, I'm actually an emergency medicine doctor. And they would look at me like it made no sense. How are you, how are you getting through to people? How are you changing their well-being? And that really was a gateway to talking about, what wellness is and how we get there. And I sometimes joke through peer support, with my colleagues in behavioral health that it is not therapy, which is very, very different. And I respect and is not something I'm trained to do, but definitely gets into therapeutic conversations for sure. But that, and the same like yoga and meditation, I've gotten very good at leading those. But really, when we look at well-being of our workforce at the end of the day, how we're going to move the needle at the end of the day, for me, it really has to come down to systems. And I think it has to come down to the rigor that we have always applied when we look at quality and safety. And I come from a change management background. I come from, a systems improvement background. And I think that's how I ended up in the role, and was positioned to really start those conversations. I think 99% of quality and safety in most places, when you say those words, that still implies quality of care for patients as it should, and patient safety. When you hear safety, most people are not thinking staff safety, because what does staff safety even mean?
Yeah.
Right? At the end of the day, we all are in this, and we all show up every single day to do the best care, right? And show up the best we can for the patients. How we get the staff to a place where they can do the high quality care, how we get the staff to a place where they're safe so they can be more compassionate, so they can make less errors, so the patients can be safer. And I think the alignment, working with so many people in quality and safety and PI just across the board, and kind of merging all of those worlds and trying to share meaningful metrics, trying to look at what are we already collecting that's patient facing, that really we could be collecting also that's staff facing. And why aren't we doing that? And a lot of the answer is because it just isn't what we're doing. Because no one's ever said we should be doing that. So trying to really define, what are those metrics?
Right.
There's great survey-based assessments that are being done. And I'm so grateful to the leaders in the realms, writing them. And a lot of our data for well-being is around that. But also, how do you add the perspective of, speaking up? How do you take your incident reporting portal and look if you have enough good catches? Are the staff putting in all the things that are near misses or that went wrong? And that speaks to the psychological safety of the staff. That speaks to how you as an institution are developing a culture that empowers the staff to feel that you want to hear them, right? And that you're acknowledging that it's all about the system. Because at the end of the day, I think we all know, whether we admit it or not, and I think more and more people are admitting it, it's never coming down to one final thing that happens, at the bedside. So many things have led up to that, and kind of how do we improve all of those systems? And another corollary to that is really with debriefing. I feel very strongly, there's emotional support debriefing, there's clinical debriefing. I don't think you can really divorce them. I think when we say, we're here to have a safe conversation, we're here to have a brave conversation, there's no agenda. What do you need? Some staff, they don't want to talk about how they feel. They want to ruminate on the medicine. They want to tell you the what ifs, because that's how they're processing. And they want to tell you everything wrong with the hospital, everything wrong with the leadership, everything wrong from their perspectives. And I really think we need to see those as their hard won ideas. They're on the front line doing the care, coming up with those ideas. And I think the way they heal is from having a place to put those ideas, to know that they're getting to someone that can take them, take it or leave it, but at least know about them. And then the flip side is some people don't want to talk about the medicine, or they're not really able to process or to talk about quality or improvement until they're able to acknowledge how devastated they are about the outcome. Whether it was a totally foreseen conclusion at the door, which in the ER, many times the cases are, but if you can't safely clear the emotion and be vulnerable, I think you get a lot less ability to then get into the safety and the quality and how you fix things. So I think a lot of this for me is kind of marrying all of those worlds and just setting up infrastructure so that whatever you're taking in from people, especially if it's from a conversation that perhaps is with a bit of pain behind it, like most of COVID was, how are we escalating those ideas? How are we capturing them? How are we actually making things better? Because that's how we'll make the staff more well.
Yeah, no, I think that's a really important point, is that you have to give people a couple of different doors to come through to understand how they can best process this. Nobody will work through it the same way. And for some, it's all about, okay, what went wrong? I need to analyze and take it apart. And for some, it very much is. I can't deal with this until I deal with the fact that, this just happened in my presence. I love that you're offering them, offering your team all of those different approaches. And especially love the piece about asking the people who are on the front lines doing the work, what is it that we can fix? They know the work better than anybody. So, as you look back at COVID, at all the work that you've done up to this point, what are a couple of key, whether it's resources or initiatives or efforts that you would have that you'd consider absolutely essential to your success? That if you had to pick up and go somewhere else, you'd say, I can't do it without X, Y, and Z.
I think that the key one, like so many things in life, is it really comes down to the most crucial resource, which is people, and having the right people. And that's everything from the right stakeholders that really get it, and perhaps can perpetuate the buy-in, to having a team. A great example is Helping Healers Heal, is our peer support program. When it started, including for myself, it was 100% volunteer. So we had trained peers that would show up to debrief or to support other staff. Again, but they were volunteering. So it was during their workday, but really, who has time to take on anything, no matter the dedication and the intentions? And I think what I know now is how much more we could have done if we had dedicated, actual set staff with protected time to do it. And then now being in this role, now having not many, but several full-time dedicated workforce wellness staff, I think that has been kind of just the exponential multiplier in our success of being able to reach people. And additionally, I think optics are important. And I think that when you pay people to do a job, it speaks volumes to the staff that it's not flavor of the day, it's not going anywhere. You actually are so invested that your money is where your mouth is. You've hired people to do this work because they matter that much. I think, and it's not huge amounts of people, although we could, definitely use a bigger team and we will get there. But I think just dedicated staff that are paid and don't have split attention and split focus has been probably the biggest lesson learned and the biggest resource. And along the lines with people, I would say, really finding mentors and advisors and just tapping into people to ask questions, the biggest thing is, again, time is so precious, is really not reinventing the wheel. And if I've learned nothing through quality and safety work, every great idea has been tried in some capacity. So if you start at why didn't it work when we did it the other 42 times, often you can start 100 steps ahead than just starting completely over. So the CHARM network of chief wellness officers has been an amazing resource for me. I'm very, very blessed. I've worked with Dr. John Ripp, who's the CWO at Mount Sinai, for a number of years, actually in a global health capacity. But he's really, become a mentor. And when I have questions, I need resources instead of having to spend days and hours hunting, knowing I have this infrastructure I can reach out to of people, has really, really been paramount. And collaborating, because we all, I think, have very, very similar pain points and struggles, and sharing ideas both fixes problems as well as, I think, just continues to pick us all up that are doing the work and keep the inspiration going, on why it matters, and reminding all of us how far we've come. And I would really say that it sounds silly to say as a resource perhaps, but social capital has been a big one. I think doing this role somewhere that I trained as a resident and I never left, and I've been in lots of different roles, I know a lot of people. And I joke, I was raised by the nurses in the emergency department who I'm still very close with. I think having relationships well established from the front line where I work, all the way through to executive leadership has helped really make gains much more quickly than if I came in, not knowing anyone and having to just pitch everything and prove everything that much harder. Kind of, the street cred alone just of working on the front line, having walked the walk, I think, speaks volumes compared to just trying to say, I see you. It's a little bit different when it's I see you and I've been in that situation. And yeah, it was a little different, but like I'm on the other side and, let's take my hand, let's collaborate. We're going to do it together. Has really, I think, again, helped kind of just expedite how quickly we move forward with putting a lot of different things into place.
Yeah, no, I can't imagine the amount of ability you have to move things forward just because you do know who the people are who you need to have on your side and on your team and who those sort of informal leaders are that need to be part of your crew to really advance something. That's great. I think that's another great example of the both intangible and tangible efforts you need to put into this work. So, can you tell me a little bit about, sort of the biggest hurdle you've faced thus far and how much was it one that you saw coming and or maybe not saw coming?
I think the biggest hurdle has been getting over this compulsion to try to boil the ocean. I think this role is so high stakes and I believe in it so strongly, like everyone that's doing this work, that especially in the beginning, it almost felt like a frantic pace of needing to try to do all the things for everyone, all at once. And luckily I took a step back after a few weeks of that and realized, number one, it wasn't sustainable, and number two, like doing everything 75% of the way was never the way to grow a program. I think that one of the biggest hurdles has really been the lack of boundaries, I guess, for lack of a better word, on what workforce wellness is. And it's kind of twofold because it's everything, right? Because well-being is truly a very personal thing, and what affects you might be different than me, different than the next person. And because of that, I think that it can become everything to everyone. And I had to very intentionally kind of set some boundaries also so I didn't get eaten alive by the requests and the job, and I still could carve out time to be intentional again at how are we looking at this from the whole organizational lens, not the individual, just the individual piece. And part of that was figuring out not how to deflect but how to collaborate, perhaps, because certain things, this is HR, and I have amazing collaborators now with HR, and we've learned a lot together. I think when you offer staff a confidential forum and they feel safe coming and sharing, that sometimes they may want to share with you because they don't want something documented. And that's okay, as long as they're safe and it doesn't need to be documented, right? Within the limits of it. So a lot of the job, and I actually have been the ombuds for a number of years, and that has helped a lot because a lot of it is guidance, but a lot of it is also options and it's communication. And sometimes I just can help connect people and be this big old bridge to you come upset about a problem, right? And your whole department is upset about this because XYZ is not happening. But I maybe know either who I can ask or that that's already underway. And yes, progress can be slow, but perhaps just giving the update, like I hear you, and it's actually, it's happening. That alone, that ability to close the loop, I think is something that we haven't always historically had. And that can really, magnify well-being without actually doing anything differently. But again, how do you take in all of the ideas, all of the issues, when we're all healers, we're all in this because we want to make everybody feel better, it's got to be a balance. And I think it's something that still I struggle with a lot because there are so many hours in the day and everyone has my personal cell phone number. And I cherish that people feel safe being vulnerable with me. But sometimes you run out of time and sanity even to kind of take it all in, because I feel very strongly if I'm going to hear it and I'm going to commit to getting you information or to helping improve something, that I will do it. So all of a sudden that to-do list that was already insurmountable, just becomes kind of frenzied volumes of information. And I don't think I necessarily saw all of that coming, just because I've, been in roles with tons of people and tons of different opinions. And I enjoy the challenge of kind of synthesizing all of it. And now we've worked to a place of putting infrastructure into, record it, to delegate it, to have accountability, people assigned so that it's not all me chasing people. You said you would help this department with XYZ, and that's really helped a lot. But I do think that wellness is everything to all people in all ways. And we're doing a good job of prioritizing what needs to be done first, what needs to be worked on the most, as a society of CWOs. But I think there are lots of discussions still around how to kind of put up the boundaries to just make sure that it stays doable and that it's maximally impactful, which is obviously the goal, of the role at the end of the day.
Absolutely. I often describe the same with workforce, which is everything, everywhere, all at once. So, how do you even start your to-do list? So, absolutely hear you, and I think that's a great piece of advice for those looking to step into a role like this. Understand that there will always be another need, but you can't care for others if you don't create the space for you.
Part of that is also, I think, a bit of responsibility, before you start asking people the questions, making sure that you both have the ability to take them in and answer them and close the loop, but also that you have the buy-in to truly take them in. And that was discussions I had before I even took the role. That's really some of the tough conversations with leadership about, we're going to learn things that are not necessarily what we want to hear. I want to hear them because that's how we improve. But, if some of this is, quote, negative or hard to fix, we have to sit with that discomfort and be okay with it and just know that we're not going to be able to fix it all. But it can be just as powerful reframing, again, how we're showing up to staff, to listen, to kind of just partner, to admit even that maybe that isn't something we can fix today, but that we're glad it's shared and we're going to, write it down. We're going to look at the themes. We're, kind of going to validate it, but not just with lip service. And that was another, big, not lesson learned, but thing I think, thankfully, I had gotten good advice around before I even stepped into the role, because there's a lot of buy-in for the endpoint, but the process is messy, right? Because these are humans. You don't know what you're getting. You have no idea what adversity, you're about to try to get 6,000, 10,000, however many employees through, with COVID, I think being the most powerful example. So you have to want the end goal, but you have to also really commit to kind of muddling through together and just collaborating and partnering and iteratively improving and doing the baby steps really to get to the end goal, which is obviously, moving the needle on people being more well.
Well, thank you, Dr. Bentley. I so appreciate you sharing your lessons learned, your enthusiasm, which comes straight through the screen. And I can feel how much excited you are about this program and the work that you get to do. And I just really want to thank you for all your contributions to both locally and then to the field in helping others understand how to do this work effectively.
Thank you. It's wonderful chatting with you. Thank you again for having me.